Aloha. This is Scott Spallina from the Senior Counsel Division, the president, and welcome to, let's see, what's today's date? October 3rd coffee hour presented by the Hawaii State Bar Senior Counsel Division. This afternoon, we have a great opportunity to learn about Medicare from Julie Agbayani-Hall, who is a licensed independent agent with Premier Benefits Consultants. She represents a variety of carriers, I apologize, including AARP, United Healthcare, Devoted, HMSA, Humana, Aloha Care, and Kaiser Medical Plan. She has been assisting Medicare beneficiaries to choose medical insurance plans since 2013. Wow. Okay. So just looking how young she looks there. So,
Thank you.
2013 there. Let's see. She's passionate about her community and servicing the needs of her kapuna clients. She provides personal service to each and every one of them and spends time to learn about their individual needs, which is definitely important. And when it comes to discussing Medicare benefits. Besides working passionately, she's also a busy wife and mother of 3 daughters. She's active volunteer also with Damien Memorial School. Her oldest daughter is at San Jose State, graduating this fall. Her middle daughter is at the University of Arizona studying law for her undergraduate degree. And her youngest is a senior at Damien Memorial. Julie, thank you for joining us this afternoon.
Thank you very much for having me. I really appreciate all of you spending your lunch hour with me. So I hope to make this presentation very informative for you and educational. So I'm going to make sure you guys can all see my slides right now. So I'll go ahead and get started. Here we go. Okay. So thank you very much. This kind of gives you an overview of my background. One of the things I wanted to also emphasize is that we do have the exclusive contract with HMSA and Kaiser here in Hawaii. I represent all plans, but definitely if you're interested in HMSA and Kaiser, we do have the exclusive partnership. So today we're going to be covering Medicare basics. What is Medicare Part A and Part B, when you can enroll, when you are eligible, how to complete your Medicare coverage, specifically Part C and Part D, what is supplement plans, what are Advantage plans, and how do I choose? On the right here is an example of what the Medicare card looks like. It's red, white, and blue. It usually has the 11 digits, and it'll show you your hospital coverage and then also your medical coverage. Okay, hold on one second. Let me get to, here we go. Okay, Medicare basics. So what is Medicare? Medicare is a federal health insurance program. It is a federal government collects contributions through FICA, a Medicare and Social Security payroll tax through your employment from your wages. The employee's share of the Medicare portion of the tax is 1.45% of wages. To qualify for Medicare, you are a U.S. citizen or a legal resident who has lived in the United States for at least 5 consecutive years, including the 5 years just before applying for Medicare, and you or your spouse has worked 10 years, which is 40 quarters in the United States, and you are 65 years of age. There are people who get Medicare who are younger than 65, and some of their qualifications are they may have a disability and they've been collecting disability benefits from Social Security for 2 years, or anyone with ALS or end-stage failure requiring dialysis. So there are 3 big enrollment periods in Medicare. The first one is the initial enrollment period, which is 7 months. It's 3 months prior to your birthday month, and then 3 months after your 65th birthday. You can enroll in Medicare Part A only, or both Medicare A and B. It depends on your situation, and we'll go into that. There are special enrollment periods for you, which is anytime you're still covered by your group health plan and are Medicare eligible, you can sign up for Medicare Part A and B without any penalties. During the 8-month period, that begins a month after your employment or coverage ends, whichever happens first without penalty. Then the other one is a general enrollment period, which is January 1st to March 31st, with coverage starting July 1st. This one may be susceptible to late enrollment penalties for both Part B medical and Part D prescription drugs. Okay, original Medicare. What they consider original Medicare is Part A and Part B. So to go over Part A, it's zero. There's no monthly premium if you're eligible. If not, there's a premium of $278 or $506 a month, depending on how long you or your spouse worked and paid Medicare taxes. The annual deductible is $1,600 per period benefit. And the period benefit ends when you haven't received hospital care for 60 days in a row. Part A covers hospitalization, skilled nursing facilities, home health care, and hospice. On the right here just kind of gives you an example of, what is covered. Days 1 to 60 is zero coinsurance, days 61 to 90 is 400 coinsurance, and then days 91 to 150 is 800 copay. You do have a lifetime reserve days, and you have a total of 60 reserve days that can be used during your lifetime. For each lifetime reserve day, Medicare pays all covered costs except for a daily coinsurance. And after day 150, you pay all costs. Okay, that was Part A. So this is Part B. This is a medical portion. There is a premium for it. It's $174.70 per month, and $240 Part B annual deductible. This covers doctor services, durable medical equipment such as wheelchairs, oxygen, CPAP machines, other medical and preventive services. The rule of thumb is that you pay 20% coinsurance of the Medicare approved services, and the government will pay the remaining 80%. It's zero for any covered, let me put this down, covered clinical laboratory services. And then higher incomes may pay more for Part B and Part D premiums. And I'm going to get into this in a few slides because this might pertain to a few of you. Okay, what is not covered? Some of the benefits not covered by original Medicare Part A and Part B is routine eye exams, eyewear, dental, hearing exam and hearing aids, cosmetic surgery, long-term care, unless you qualify by means of Medicaid status, and medication, which is Part D, is what they call it, prescription drugs. So Medicare costs. So your Medicare cost is based on your modified adjusted gross income as reported on your IRS tax return from 2 years ago. If it's a certain amount, you'll pay the standard Part B premium, which I said was $174.70, and your IRMA. The IRMA is your income-related monthly adjustment amount. It's a surcharge added to the monthly Medicare Part B and Part D prescription drug premium. Social Security Administration uses income tax information from 2 years prior to determine if a surcharge is owed in addition to the Part B monthly premium and Part D monthly premium. The surcharge amount paid depends on your income tax brackets and how you filed. So I have an illustration here, and this is usually where people start taking a little pictures. This is for 2024. If you were to retire this year, they are going to look back at 2022. So you can look at the different, individual, married, filing joint, and then married, filing separate. So if you look at the column, and if your income, we'll just use, is between 193 to, 499, you can go to the column there where it says what your IRMA would be, your surcharge would be $384.30 plus the $174.70. So your Part B premium, which includes the IRMA, would be $559. And then you will also have a Part D IRMA, which is whatever your drug premium is, plus the $74.20. Okay, completing your coverage. Once you have your Medicare Part A and Part B, you can decide of different options. The options that are available to you is you can do a Medicare supplement policy and a standalone Medicare Part D plan, which is your prescription drug, or you can choose to do a Medicare Part C, which are the Medicare Advantage plans that you're starting to see a lot of advertisements for, like the HMSA Acoma Advantage, Humana, United. All the plans are starting to do their marketing currently because of the open enrollment happening. Completing your Medicare coverage. This is just a real good flow chart. I think it gives a great visual of the differences between the two. So if you go the first way, you have your Medicare insurance card, you have your Medicare supplement plan, and then you'll have your Medicare Part, your Part D, your prescription drug plan. So you'll be carrying 3 cards in your wallet if you decide to go that route. The other route of going the flow chart, you only have 1 card, and that would be your Part C, your Medicare Advantage plan. You can keep your Medicare card, at home. So you only have 1 card if you choose the route of just going with a Medicare Advantage plan. The Medicare supplement policies, it started in 1980s. It's offered by private insurance companies, also known as Medigap plans. There's 10 standardized national plans, and the premiums usually increase yearly. Anywhere from 5 to 8% is on average what the increase is. It helps to pay for some or all of the out-of-pocket costs that come with original Medicare. It is a supplement. To original Medicare Part A and Part B benefits only. It does not include the Part D drug coverage, so that's why you'd have to get a separate Part D coverage. It usually has no extra benefits added, such as free gym membership or vision, and the plans vary from state to state. Okay, so going on the second route, the other option is going with the Part C Medicare Advantage plan. The Medicare Advantage plans were created in 1997 with the plan sale starting in year 2006. It's offered through private insurance companies. It pays instead of original Medicare. It covers all the benefits of original Medicare Part A and Part B. It also may include extra benefits like dental, vision, hearing, gym membership, emergency coverage outside of the US. And many of the plans here in Hawaii include Part D prescription drug coverage that's included in the plan. So you will not have to get a separate Part D plan for this one. More about Medicare Advantage. It says you must continue to pay your Medicare Part B premium. You must have both Medicare A and B to enroll and have a valid enrollment period. You'll show only your Part C Advantage card when you go to the doctor or the pharmacy. These Advantage plans have a built-in safety net, which is the annual maximum out of pocket for hospital and medical only. There is catastrophic coverage amount for prescription drugs. It's best to use network providers to keep costs down, like an HMO or a PPO. You may qualify for financial assistance. If you enroll in Part B or Part D late, you may incur late enrollment penalties. A Medicare Advantage is not the same as a Medicare supplement plan. Other types of insurance is COBRA. So I'll go briefly over these. COBRA is a continuous coverage to keep your employer group health plan that you pay for, which is offered up to 18 months and 36 months in some cases. You have 8 months to sign up for Part B without penalty, whether you choose COBRA or not. And if you miss this period, you have to wait until January 1st or March 31st to sign up. The coverage start date will be July 1st. This may cause a gap in your coverage, and you may have to pay a lifetime Part B late penalty. The marketplace is here, the Affordable Care Act. It's ACA here in Hawaii. It's against the law to have both marketplace insurance and Medicare insurance. So usually when you sign up for Medicare, they'll send you a notice that you have to cancel your marketplace insurance. TRICARE for Life, some of you may have this. It's through the military. You must be enrolled into both Medicare Part A and B to apply for TRICARE for Life. Medicare pays first, and then TRICARE for Life will pay second. If you get items or services from a military hospital or other federal healthcare provider, TRICARE pays first. You may have VA. If you have both Medicare and VA, you can get treatment under either program. Generally, Medicare and the U.S. government of Veterans Affairs can't pay for the same service or items, so you have to choose which benefits to use. There's health savings accounts. I won't go into that, and then there's also flex spending arrangements where they allow employees to be reimbursed for medical expenses. And these are usually funded through voluntary salary reduction agreements with your employer through pre-tax dollars. You can't receive distributions from SA for health insurance premiums, and you cannot use it to pay for Medicare insurance premiums. So these are just some check-in questions we have just to make sure everybody this is the main points. At what age should you enroll into at least Medicare Part A? That's the free Part A. So we usually say 65. Even if you're still employed, you want to make sure you turn on your Part A so you'll have dual insurance for hospital. And then Part B, you don't have to turn on until you're actually ready to retire. How do you sign up for Medicare? It's all of the above. You can go to the website, you can call Social Security for help, or you can go down in person to the local Social Security office. Is Medicare an individual or family plan? It is an individual plan, so a husband and wife will each have their own Medicare cards. And is there a premium for Medicare Part B? And the answer is yes. And the base amount is $174.70. Okay, completing your Medicare coverage. So I put here, it's a sheet because you're going to have to choose between the two. And these are really just the highlights to kind of give you an overview of what the differences are. So the Medicare Supplement and Part D drug plan, it's if you don't mind paying a higher monthly premium in exchange for zero or little out-of-pocket costs for hospital and medical services, because Medicare is going to pay first, and then your Medicare supplement plan will come in and pay the, how we were saying your portion will be 20%. It'll come in and pay that 20%. The premiums increase yearly, 5 to 8%. The coverage goes with you anywhere in the United States. It's preferred to use, if you're familiar with like specialty clinics on the mainland, like Mayo or MD Anderson for cancer, the Medicare supplement plans are definitely a good route to go for that. Or if you have chronic health conditions and see doctors often, and if you anticipate surgeries. The Medicare Advantage plans would be good. It's an all-in-one bundle plans. It includes hospital, medical, usually prescription drugs, vision, and extra benefits such as dental and free fitness. You're in good health, minimal prescription medicines. The premiums vary starting from 0 premium month here in Hawaii. There is an annual max amount of pocket, which provides peace of mind financially. And then plans have provider networks that you must review, whether it's a PPO or an HMO. And I think all of you know the difference, but a PPO is just preferred provider network. And then the HMO is, you have to stay within your network. So here in Hawaii, an excellent HMO is Kaiser. And then you can use HMSA as an example of a PPO. So you can see the difference between the two. Okay, here are some resources that are available to you. You can go, and usually the go-to website we all say is the medicare.gov for any questions. You can also go there and plug in your drugs, and it can give you an idea per plan of what the cost would be for 2025. You can go to hawaiiship.org, Medicare Made Clear, or mybenefitshawaii.gov. So some tips to remember if there's any takeaways is to, when you turn 65, even if you're still employed through your company or your spouse, you can do this 3 months before your birth month to sign up for your Part A, which is the free portion of your Medicare, your original Medicare. Number 2, show your Part A Medicare card in addition to your employee if you have hospital services. You're going to contact me 3 to 6 months before you lose employer medical. I can help put you on Medicare Part B and a supplement or advantage plan at the same time. And something to keep in mind, if you have retired medical coverage from a private employer union, you do not need to pick up Part C Advantage Plan or a Medicare Supplement Plan. By doing so may cause you to lose your retiree medical plan. It's okay for feds to pick up Part C. So for example, if you work for the state or your spouse works for the state and you get state benefits, if you enroll in a Part C Advantage plan, which is like the Akamai plans here, you can actually lose your state benefits. So make sure you don't do that. But if your wife or if you work for the federal government, you can absolutely do that. So you do have some options. You always want to make sure that you're talking to a consultant before you make any changes, because we want to make sure that you don't lose any benefits that you've worked hard for. So this is my contact information. I have my QR code there on the bottom. So feel free to scan that and keep me in your, on your phone when you're ready to retire. Or if you have any questions along the way to sign up for Part A or Part B, I can definitely be a resource for all of you. So is there any questions that you folks might have? I can go ahead and open that up.
Yes. Okay. So if anyone has any questions in the room, please use the Q&A function to place your questions. All right. Let's give it a few. Okay. Yes, we got one question here. I am a state retiree at 65. At 65, I need for Part A. Do I need to get Part B and C?
Okay, let me get this. I'm getting off I'm trying to, can you hear? See, you do not have to do anything. The state is going to walk you through the process. So you are completely fine. There's nothing you need to do. They'll send you all the paperwork that needs to be signed, but do not pick up a Part C, because if you pick up the Part C, it'll cancel your state and they don't let you go back.
All right.
So I hope that helps.
Next question. Okay, can I get a copy of the slides?
Absolutely.
Okay.
You can email me and I can send them to you yeah.
Yes. Okay. Next question. If I receive benefits from my wife's retiree benefits, but I will turn 65 next year, will I need to get Medicare? What do I need to do?
You do not need to get I would recommend getting your Part A because it's free. You don't have to do anything. You should definitely get that. You do not have to pick up your Part B because you're getting your benefits through your wife, and your wife's plan, because it's an employer plan, will be considered credible insurance. So you only need to get it when she retires. Then you both can call me and then we can talk about different options. But if you are getting your insurance through your spouse, as long as they're still working and they can cover you and it's credible insurance, you will have no penalties.
Okay. Okay. Next question is, have retirement insurance, which is great. Turning 65 next May. I don't want to lose what I have. Working now, no benefits from this employer, and I think there's a follow-up. This person has a BCBS, I believe. Yeah.
What is I apologize. I don't.
It's B as in boy, and then C, BS.
Is it that BCS a retirement plan that you're paying separately?
Blue Cross. Okay, there.
Oh, you have Blue Cross Blue Shield. Okay. So you're paying, is that an individual plan that I'm sorry, individual plan?
Retiree plan.
Okay, and is it retiree plan through private or is it through federal?
From the state of New Mexico, I believe. I believe that's what NM stands for.
Yeah, so I believe, and like I said, and we can look at it individually, but any plan that comes through the state, we always have to make sure, sometimes you see a lot of commercials and you see a lot of people at, the malls or at Safeway, and they're like, join this Part C plan. It doesn't cost anything, it's zero. Well, I would always sit down with somebody and I would actually call your state insurance and make sure that they coordinate. Because the last thing you want to do is to pick something up for a free gym membership or free dental, and you think something's going on and it cancels the retiree plan. So rule of thumb, really, any state retiree plan usually doesn't work well with the Part C plan or with the supplement plans. The only ones are the federal government, which is here in Hawaii is like Fed 87, and maybe some, private companies.
Okay, let me just shuffle through these questions real quick. Okay, next question. What if we already have in a Part C supplement plan and then we're become and then we're be oh, and then became a state or city and county employee?
If you already have Part C. Okay, so if you have a Part C, so I'm assuming what happened is they might have gotten it, and then because I have some people who think they're going to retire and they pick up a Part C or a supplement plan, and then after a year they decide to go back into the workforce. And if that's the case, you can suspend your Part B. So you don't need to pay for your Part B because you'll be getting credible insurance through your employer. So you don't have to do both. You can, but it's not necessary because then you'll just be overinsured. And you could save the money paying for your Part B because, like I said, it's $174. And if you incur an IRMA surcharge, it might not be worth the coverage.
Okay. Next question. What if my wife is already retired?
Okay, if your wife is already retired, if she's getting insurance through your employer, then all she has to do is turn on her Part A. Because she's getting she's being covered through your employer plan.
Okay. All right. Next question. I am considering knee replacement surgery and retirement on February 1st of 2025. Should I do it now while covered by my employer, or can I wait?
You can wait. I mean, that's your decision. I mean, I can sit with you and or afterwards we can just email me and I can show you the plans for 2025. And that way you can make it educated. You can compare it to your employer plan and the new plans for 2025 and which would be better for you.
Okay. Next question. I have HMSA through my wife and working for the state. I signed up at 65 for A and B, still working. I was told to sign up for Part D, which I did. Is this right? Am I paying for the IRMAA? How can I challenge the IRMA amount
Okay, so
that I paid?
So if your wife, and that's an individual basis, if your wife is working for the state or retired from the state and did over the 20 years, then they usually reimburse you for your Part B. So you might not be paying the Part B premium. It might be part of her retirement plan.
Okay. Next question. Employer provides family insurance coverage and continues to work after I turn 65. What happens to her coverage of what happens to her coverage of me after I start Part A?
You can still be on her. So is it saying that the wife is carrying the insurance?
Let's
Or
see.
is
Employer. Employer provides family insurance coverage and continues to work after I
So
turn 65.
yeah, you can continue working until, it doesn't affect their turning in your Part A does not affect your family. So it's just basically only if you use it if you go to a hospital, you have dual insurance. But if you're working and you're employed and you have your wife is younger and you have children, their group insurance will stay intact.
Okay, next question. Uh, I'm soon to be 71 years old, state of Hawaii employee, currently on Part A only, since I still have Kaiser Permanente coverage, who plans to retire in late 2025. I heard there is a very good state advantage plan. If true, can you please elaborate on that?
So they're when the state negotiated with the private companies, of course, they have the strength of the amount of people. So their plans through the state are usually very robust and they're most comprehensive here in Hawaii. I don't have since I don't represent the state plans and they're kind of negotiated separately, I don't have the details to the plans, but I know that everybody's very, they're very, very happy when they're on the plans. They take really good care of the state employees.
Okay. Next question. Please expand on the different benefits of a supplemental versus advantage plan. How do you decide which to choose?
Okay. It really comes down to your comfort level and it comes down to comfort level. It comes down to your where you are financially. Just for me, I have, my father-in-law chose the supplement plan, that route. And then my father went with the Medicare Advantage plan. My father-in-law, he lives in Arizona. He goes to the Mayo Clinic. He was a CEO, income was higher. He was okay with paying the higher premium to get kind of that level of care where he could go to the doctor and he didn't have to worry about deductibles or premiums or anything like that. So he went with a supplement plan and they do a lot of traveling because they're in Arizona. They go, they go up to, there's different counties. So they go all the way to Flagstaff or, they go to Las Vegas. He does a lot of traveling. For my father who lives here in Hawaii, and he doesn't travel as much, and he worked for the federal government, he's part of HMSA. He chose the HMSA Akamai Advantage plan. The benefit to him is there's very little cost. Usually the advantage plans, even though they're not, everything is zero, like you could have like zero premiums, they give you, each plan has a max amount of pocket, and the max amount of pocket could be anywhere between 3,400 to higher up. So my dad just knows that, he kind of can budget that if anything catastrophic happens, he knows what his max amount of pocket would be. So that worked better for him. Instead of paying the high, I should say the higher monthly premiums, he decided, and he doesn't travel as much, and he gets all his medical here at Polymobi. So it really just depends on, what your goals are when you retire and your financial situation, which works.
Okay, I'm not sure if this is a question, but it says wife employer provides family coverage, and that's all it says for this question. Or okay, um, I think we can if this person could possibly elaborate on this statement, whoever sent this, we can get back to you on that. All right, next question. What about those that currently receive benefits through a state retired spouse, but will turn 65 next year?
It'll continue with this. The state will walk you through that. They don't have to worry about it. They'll stay with the state. They'll tell them to pick up their Part A and their Part B. Like I said, some state employees and some plans, they do reimburse for part of their retirement is reimbursing them for the Part B. And I believe the state also will take care if there is an IRMA surcharge.
Okay, next question. Are any of the plans experience-based? So we are penalized with higher premiums based on prior usage.
No. No, not at all. No, no, no. You don't. So I'm assuming you're thinking that if you use the plan more, if your premiums are going to go, like, okay, I think I know what you're talking. Like, when you do your car insurance, the more accidents you get, or things like that, the next year your premiums go higher and higher. That is not how insurance works. It is not based on utilization.
Okay, I think this is probably like um another another question. Uh I'm not too sure if it is a question, but if this person could possibly elaborate on this particular question here. It says, FYI, I will not be employed by the state for 20 years. So if this person wrote this question, could you maybe please elaborate a little bit more, and then we can come back to you, or maybe email Julie. All right, and then I think this is the final question in the Q&A. What type of plan is devoted?
Devoted is a new plan that came into the market this is going to be their 3rd year. It is a PPO, and it's considered a Part C plan. So that's the one where you just carry the devoted card, and it pays first. You keep your original Medicare card at home.
And I think that's all the questions in the Q&A. If anyone has any more questions to ask Julie, her email address is listed on the slide, Julie at pbchawaii.com. And then Scott, are you still there? Do you want to give
Yes.
your closing remarks?
Yeah. First of all, I want to thank Julie. Julie, this is as you can tell by the questions, or
It was fun. It was fun. I'm ready for another 10. I'm good.
Oh my gosh, there. No, this is the most questions all year we've had to any of our speakers. That should be a testament as to how important the information you have is. To one of the questions asked earlier about whether you get copies of the slides, you were generous enough to allow us to record this. And so this will be uploaded to our YouTube channel under Senior Counsel Division of the Hawaii State Bar. So those people that are listening, you can see Julie again in reruns on YouTube in maybe a week or so, and check out also some of our other great speakers we've had this year and prior years with the Senior Counsel Division. But Julie, I definitely want to thank you for making the time to join us today and answering all these very important questions that people definitely need to know the answers to. And also, I wish you luck in raising your 3 busy daughters there. I mean, we were talking about this beforehand, and I don't know how you could be so knowledgeable in this, plus also raise 3 daughters in their busy lives right now. So thank you for joining us today.
Thank you very much. No, this has been my pleasure, and it's been fun. And like I said, all of you have my email. Please feel free to give me a call at any time if you have any questions along the way, because I know it's very confusing. Medicare here, and every year there's changes. I've been in the business for 10 years, and this year is the most changes in Medicare that we're seeing especially for the prescription drug plans. So, it's really good to just stay on top of it. So you don't want any surprises when you go to the doctor or pick up your prescription drugs. So thank you very much for your time, everybody.
Thank you. Have a good afternoon.
Bye.
Bye-bye.